Well, hello everybody. My name is Emily Bright with DocStyle.com. I'm hosting this webinar on behalf of DocStyle. Today, we'll share more about mid-facelift surgery. At the end of this presentation, viewers are invited to schedule a remote consultation with a doctor who performs this procedure. We'll also be answering questions throughout the webinar to help you learn more. Okay, so let's begin. A mid-facelift is a popular alternative to a full facelift or a neck lift, perfect for those who don't require a lift in the lower part of their face. Instead, this procedure targets three main areas: correcting under-eye bags, hollowness in the upper cheeks, and prominent nasal folds. The great news is that 9 out of 10 patients who undergo this procedure report significant aesthetic improvement following the surgery. It boils down to this: a mid-facelift is a surgical cosmetic procedure that reduces signs of aging. It's a powerful method of facial rejuvenation, also commonly referred to as a cheek lift. The best candidates for this procedure are healthy men or women who want to reverse the signs of aging, those who have lost elasticity and tone in the face, or who have sagging skin, especially around the cheeks. This procedure is often done at the same time as an eye lift, so if you're scheduled for that procedure, it may be a good idea to ask about getting a mid-facelift as well. In addition to positive results, patients like that this procedure is performed as an outpatient procedure, which means that the patient can go home the same day. When compared to other types of facelifts, a mid-facelift provides targeted results and improved precision. This procedure is also less invasive than many other face and neck lift procedures, and therefore causes less bruising and swelling for the patient. This procedure targets the nose, eyes, mouth, and cheeks to reduce signs of aging. A mid-facelift can solve issues such as sagging skin, lack of elasticity in the upper face, and reverse signs of aging. Many patients also feel more secure after the procedure and report a boost in confidence. Let's take a look at the procedure. Step 1. The patient is put to sleep using a general anesthesia. Step 2. Small, deep incisions are made in the face's muscle tissue. Step 3. An endoscope may be entered into the skin. Step 4. The surgeon adjusts fat and muscle tissue and pulls up the middle of the face. Step 5. The incisions are then sutured. Step 6. The patient is wheeled to recovery. The average time for a procedure like this varies. On average, however, patients can expect to spend 20 to 30 minutes under the knife. Before committing to the procedure, it's important to understand the recovery process. Because this is an outpatient procedure, patients can go home the same day. Recovery time is about 1 week on average. However, patients who undergo this procedure endoscopically will often recover faster. As with any procedure, there are risks. If you received an oral sedation, remember that there are risks associated with general anesthesia. Like all surgeries, this procedure also carries risk of bleeding and infection. Those who undergo a mid-facelift may also experience swelling, bruising, a facial nerve injury, facial asymmetry, or delayed wound healing. The exact cost of a mid-facelift depends on many factors, but the average cost is about $7,000. Keep in mind that insurance likely will not cover a cosmetic procedure like this one. If you'd like to schedule a consultation to learn more about this procedure, click our link on the right-hand side to connect with a doctor. Thank you all for your time.